Welcome to StartUpHealth TV, where we celebrate the entrepreneurs and innovators who are transforming health. My name is Logan Plaster. I'm here with my guest, Yair Saperstein, CEO and co-founder of AvoMD. Yair, always great to see you.
Logan, it's always a pleasure.
So I want to have you pitch AvoMD, but you've built a product that really hits physicians between the eyes in terms of addressing pain points. I want to know how you explain AvoMD to non-physicians.
So for non-physicians, I always say, you ever show up at the doc and you realize that they're in a rush, or perhaps that whatever you Googled is more correct than whatever it is that you're being told by the physician? That's a problem, right? And every patient has had that kind of experience with at least one doc. And you wish that there was some way that your doc would know what you know, right? And that's number one. And number two, wish that they would have more time so that they have more time to spend with you. So the thing is that physicians are feeling that also. And if there's some way of serving physicians and giving them that ability to have all of the up-to-date information that they need, correlated with all of the information that's already known about you, the patient, and then done in a way that's super efficient so that they get the time back to spend with you, that would make everyone's lives better, and that's what Avo does.
All right, so that's the human impact. What's the product?
The product. We bridge between evidence and care, meaning we take the clinical guidelines, society pathways, the hospital protocols, the outpatient clinic guidelines, right? All of this information.
There's so many.
And we take it and turn it into a point of care app. And this app exists both inside and outside of the electronic health record at the point of care, where the physician, the clinician, nurses, right? Anyone has the ability in the course of giving clinical care to access that information in algorithm format, taking in the patient data in the EHR integrated version, or inputting the patient data for that little bit of input that's needed, and having the output. Here's what you need to do next. Here's a note that's generated for you. Here's orders that are generated for you so that you have the time to be able to spend with patients.
Give me a specific example, a scenario where a doctor would come in and they would want to know more about maybe a risk score, and they'd say, I wish I had that calculation right in front of me. What's one of those encounters?
It's even more than just a risk score or calculation. It's about implementing that risk score within the process of a pathway, within the process of a workflow. So physician working in the ER has a patient with chest pain. What do you do for a patient with chest pain? So you need to understand a risk score. Oftentimes the heart score is used, where you're calculating the value from the heart score to understand what's the risk of having a cardiac event over the next 6 months, and that can guide what you're going to do with the patient right then. But that's also in the context of other things that are going on. How long has it been since the patient started having chest pain? How long since the patient showed up in the ER? Is there cardiac on staff in the hospital now, and what do I need to do with it? What do I need to do with the patient based on the risk score, given the availability of what I have within my health system right now at this moment? And we take all of that into a pathway that's relevant for me, the doc, at the point of care. Here's your risk score and when to use it. Here's the values that are auto-integrated. Here's the next steps here. Here's your note. Here's your referral path. Here's the orders that are needed.
Amazing. Talk to us about your major milestones. When did you launch the product, and kind of what's the rollout looked like?
So we started in 2020 when we all went full time. The product existed in various forms before then, but we really launched in 2020. We started as a mobile app. So it was available Android, iPhone. We still are a mobile app, but now we're also on web and also in multiple EHR systems. So if you're using Epic, for example, you can get us from the Epic App Market for your health system.
Was that a big milestone?
That was definitely a big milestone.
It seems like a big deal.
Yeah, definitely a big milestone. Yeah, it was the first within the US, and then the first of many, which are some in progress, some already done. Okay. Another big milestone is completing the builder. So we're able to produce this point of care app for clinicians.
Gotcha.
But the thing is that in every health system, people do things differently, right? You can show up in one health system, they do it differently than another health system. And if you're working in one health system, how do you know what they do? It doesn't matter what the society says, it matters how you should practice here. So you're able to customize it as a health system for that health system's needs and for what the health system wants using our no-code builder. You don't need a programming language. It's a second milestone.
It's almost like a WordPress, Squarespace, just for consumers, like a way for people who are not programmers to kind of pull together a program.
Exactly. And the point of it is that it allows for this point of care app to be built and customized by the clinician experts without needing the IT side. You don't need to be an informatician to be able to edit this, so the quality and safety officer who knows the clinical content can be the one who's actually in charge of it, instead of needing to wait a whole year for IT approval, and then by then it's out of date.
Yeah. Talk to me about the cost, the human cost of not having these kinds of assistants. We hear every day about physician burnout. We hear about the workforce crisis, young doctors just flaming out of the profession. So what happens to doctors when they are given these mountains of information and sort of no help in understanding how to decipher what's most important?
It's one of the many causes of burnout, right? Which is the converse of wellness. Wellness is you feel good, you feel empowered, you have the resources to be able to do what you have the responsibility to do. If you don't have that, if there's that gap between what you really need to do but having the ability to do it, you feel like you're not empowered. And as a clinician, that's the worst feeling. You want to be able to serve, you want to be able to provide, you want to be able to fulfill your responsibilities for your patients, and you can't because there's so many things to do and you don't have the tools to do it.
Yeah. Did you experience that?
I did.
Yeah.
I did. Yeah, it's actually when I experienced it, my answer at the time was to start the wellness committee in SUNY downstate, where I was doing residency, and that addressed part of it, but didn't get to the core of the issue that I was experiencing. This helps address the core.
Okay. Where do you feel like it's going? I mean, who do you want to partner with next? How big could this get?
It is starting to grow in a way that we're feeling the momentum, which feels really nice. From the health system side, we're having more and more health systems adopt it. So I say to any health system that is watching, if you're interested, let us know. We have a freemium model, so we allow for health systems really to try it at no cost. And to continue to use it. It's not like there's a trial period. It's the basic access is free, even inside of the EHR. And then we also work with different pharma companies, different medical device companies. When the health systems allow for us to share the physician level usability data, meaning are the physicians using it, how often are they using it, we share that data back, which allows for pharma companies that are interested in that to get involved with us.
Yeah. The product really makes me think about the future of the tech-enabled physician. You think about having this assist, whether it's your mobile phone or I can imagine Google Glass or whatever it is, you have this assistant. Where do you see the future of the AI-assisted, tech-enabled doctor moving in the next 5 years?
Yeah, AI has started to come much more into the public perception recently. We've actually integrated GPT-4
Really?
into the
In what
builder
way?
side. So when you're trying to we work with societies, right? And when these societies are trying to take their guidelines and turn their guidelines into algorithms that are EHR accessible, that's a tough task. And if you try to automate it fully, it ends up not really working, and it can go down the Watson Health path and
Sure.
some of those failures. But if you're able to have it in a controlled way, almost like an intern creating it for you that can then be looked at by an expert clinician, it just makes the process faster. So within our builder, GPT-4 can help create these pathways. Clinicians can check it to make sure that it's good, and then it can go out for clinicians to be able to use. That's one way. And I really think that that's a microcosm of the general ecosystem of you can have tech-enabled care where it is the physician, the clinician that is giving the human element and having that check beforehand, not totally giving over to AI, but being enabled to allow for those processes to help within the process of care.
I've heard it said that doctors won't be replaced by robots or AI. They'll be replaced by doctors who use AI.
I like it. Yep.
Yeah.
I feel the same way.
Yeah, and I can tell that Avo is starting to build some of the systems necessary, whether it's on your phone or computer or whatever the platform is, the technology, bringing together those standards is what's important.
Yep.
Very cool. What are you most excited about for the next year?
For the next year, one aspect is the revamp of the builder. So when you're trying to we work with societies, right? And when these societies are trying to take their guidelines and turn their guidelines into algorithms that are EHR accessible, that's a tough task. And if you try to automate it fully, it ends up not really working. And if you try to So we have a Builder version 2 coming out, which is even easier for clinicians to be able to use and utilize to be able to create these pathways. The second is continued EHR integrations as we add in not just Epic, but Athena, Cerner, and eClinicalWorks. We're able to allow for more of these health systems to have it integrated directly into their EHR workflow in addition to outside.
It's going to be an exciting year.
It shall be.
All right. Congrats, Yair. Always great to see you, and we'll be watching your progress closely.
Sounds great.
All
Always
right.
a pleasure, Logan.